The epidural is systematic review, another systematic review by Peter Coy from McMaster University, and he is studying the epidural analgesia versus systematic analgesia following knee and hip replacement. Is lumbar epidural analgesia more efficient than systemic analgesia or long-acting spinal analgesia for post-operative pain relief in patients with elective hip or knee surgeries? Conclusion: epidural analgesia may be useful for post-operative pain relief following lower limb joint replacement, and epidural infusion of local anesthetic or local anesthetic narcotic mixture better than the epidural narcotic alone, and the magnitude of pain relief must be weighed against the frequency of adverse effects, and the current evidence is insufficient to draw the conclusion on frequency of rare complications from epidural analgesia, post-operative morbidity, mortality, functional outcome, and length of hospital stay. This is published 2003 by Peter Coy, and he republished the same data in 2013. Major complication of epidural analgesia. A retrospective case note review was done by Christie from UK and Maccabi from Australia, starting in the year 2000 and ending 2006, and published in 2007. They studied 8,100 patients, 6 cases of epidural abscess, 3 cases of meningitis, and 3 cases of epidural hematoma. And the symptoms of epidural abscess and meningitis developed a median of 5 days after epidural catheter removal, while the symptoms of epidural hematoma developed while the catheter is still in place. Diagnostic delays contributed to adverse neurological outcome in 3 patients, and the study suggested that leg weakness is a critical monitor for spinal. ASRA to introduce the evidence-based guidelines, the 4th edition in 2018, published in Regional Anesthesia and Pain, and according to the classification, neuroaxial block and deep non-compressible peripheral nerve block are high risk in regional anesthesia in patients receiving antithrombotic or thrombolytic therapy. They are the consensus of this group represents the experience of recognized experts in the field of neuroaxial anesthesia and anticoagulation, and according to them recommendation, protocols must be in place for urgent MRI and hematoma evacuation if there is change in neurological status. We must focus on rapid diagnosis and treatment to optimize the neurology. The limitation of epidural analgesia after knee surgeries are in patients with anticoagulation and increased risk of neurological complications, and in patients with cardiac morbidity, significant hemodynamic changes. The adverse effects are including risk of fall, urinary retention, and a question: is epidural analgesia still a viable option for enhanced recovery after knee surgeries? And the answer is coming in this study, Anesthesia and Analgesia, published in British Journal of Anesthesia 2018 for knee joint arthroplasty by Donnell from Glasgow. And the statement: benefits of epidural analgesia with surgical outcome have been well documented in the literature. However, the epidural analgesia has significant failure rate and requires more intensive nursing vigilance, including high dependency admission to manage hypotension combined with the potential for adverse effects including urinary retention, pruritus, nausea and vomiting, motor blockade. Epidural analgesia delays recovery after TKA and often regarded as incompatible with enhanced recovery protocols.